Welcome to the MD Edge Daily News for Monday, September 10th. I'm your host, Nick Andrews. Today, statins are not preventative in the elderly unless they have diabetes. Also today, children who were born from assisted reproductive technology have risk for arterial hypertension, and Supreme Court Justice nominee Kavanaugh on the future of abortion. But we begin today with new guidelines for patients with cancer-related immunosuppression. Fluoroquinolones are recommended for these patients if they have high risk of infection. This is according to new recommendations from the American Society of Clinical Oncology on antimicrobial prophylaxis. By contrast, patients with solid tumors are not routinely recommended to receive antibiotic prophylaxis, according to the guidelines published in the Journal of Clinical Oncology. The guideline includes antibacterial, antifungal, and antiviral prophylaxis recommendations, along with additional precautions such as hand hygiene that may reduce infection risk. For the most part, the panel endorsed the previous ASCO recommendations published back in 2013. However, the panel considered 6 new high-quality studies and 6 new or updated meta-analyses to make modifications and add some new recommendations. In the 2013 guideline, fluoroquinolones are recommended over trimethoprim sulfamethoxazole because of fewer adverse events leading to treatment discontinuation. Panelists for the new guidelines said they continue to support that recommendation based on an updated literature review. The panel also recommended fluoroquinolone prophylaxis for the high-risk patients, including most patients with acute myeloid leukemia, myelodysplastic syndromes, or those patients undergoing hematopoietic stem cell transplantation. And any benefit of statins for primary prevention in older adult populations may depend on whether or not they have type 2 diabetes. This is according to the results of a retrospective cohort study published in the BMJ. The study examined over 7,000 patients 74 years of age or older who had no clinically recognized atherosclerotic cardiovascular disease, as well as more than 7,000 similar patients with diabetes. Researchers report that statins had no protective effect overall in the study. However, they also report that in older patients with diabetes, statins were associated with reduction in CVD incidence and all-cause mortality. They report that this benefit was substantially reduced in patients 85 and older, and it was completely absent in patients who were 90 years old or older. Dr. Rafael Ramos is a researcher at the University of Girona in Spain. Dr. Ramos says that these results do not support the widespread use of statins in the old and very old populations. He also notes that the data do not support treatment in those with type 2 diabetes who are younger than 85 years old. Children who were born from assisted reproductive technologies like in vitro fertilization or intracytoplasmic sperm injection may be at risk for developing arterial hypertension due to premature vascular aging. This is according to new research published in the Journal of the American College of Cardiology. Researchers assessed vascular function in 54 participants who were born with ART who returned from a previous study 5 years after the initial assessment. In the previous assessment, the researchers examined vascular function. Initially, the researchers found that vascular dysfunction in this population was not related to parental factors, but it was related to the ART procedure itself. Upon reassessment, the researchers found that there was no significant differences regarding BMI, lipid profile, and a handful of other factors. In the reassessment, researchers report that there was about a 25% reduction in the flow-mediated dilation of the ART group compared to patients in a matched control group. Dr. Emrich Rasage is the director of the Arterial Hypertension and Altitude Medicine at Intraseptal University Hospital in Switzerland. Dr. Rasage says that there is growing evidence that ART alters the blood vessels in children, but the long-term consequences were not known. He also knows that we know that this places ART children at a 6-time higher rate of hypertension than children conceived naturally. And finally today, Supreme Court Justice nominee Brett Kavanaugh suggested that precedent would guide his thinking when it comes to deliberating on any Roe v. Wade challenges. However, the nominee did come short of saying that he would not support overturning the landmark abortion rights case. In testimony in early September, Judge Kavanaugh noted that the decision of Roe v. Wade has been reaffirmed in follow-up cases, and that would play a significant role in his approach to future challenges. Judge Kavanaugh said that as a general population, he understands the importance of the precedent set forth in Roe v. Wade. He also noted that Roe v. Wade is reaffirmed in Planned Parenthood v. Casey, that a woman has a constitutional right to obtain an abortion before viability subject to reasonable regulation by the state, up to the point where that regulation constitutes an undue burden. Judge Kavanaugh cited cases where he went against former President George W. Bush as to why he would not serve to protect the current president and would not act as his puppet on the bench. And that concludes this edition of the MD Edge Daily News for Monday, September 10th. You can subscribe to the Daily News wherever you get your podcasts, and you can find links to these stories in the show notes. For MD Edge, I'm Nick Andrews.